Well, I'd like to welcome the gentleman you just saw in that spot there, Dr. Rachev. He is the medical director of the Stroke and Neurointerventional Program at Saddleback Medical Center. Nice to see you again.
Nice to see you. Thank you.
Welcome
for having
back.
Me.
First, let's talk about, before we get into the program, I think sometimes people are confused as to what a stroke is.
Sure.
And how debilitating it can be. Can it be, you know, in certain parts of the body, up in the brain? So let's first talk about what a stroke is.
Yeah, thanks for this question. That's very important to define what we're talking about today. So stroke is a damage to the brain because of a brain vessel problem. That's what stroke is. The most common type of stroke is due to a blockage of a brain vessel, which is called ischemic stroke.
Okay.
That's about 80 to 85% of all strokes. And that is usually due to a clot that travels from somewhere else. Usually the heart goes up into the brain vessel, lodges in the brain vessel, and then once that happens, there is a sudden blockage, inadequate blood flow to the brain, and damage to the brain as a result of that. And when that happens, the patients experience symptoms. Another type of stroke is the so-called hemorrhagic type of stroke, or bleeding type of stroke, in which case the blood vessel ruptures and there's a leakage of blood into the brain, and that is also associated with pretty debilitating symptoms. So either way, stroke is quite devastating, either ischemic or hemorrhagic. In both cases, there's a damage to the brain, and as a result of that damage, patients are experiencing symptoms.
Right.
The brain is responsible for many things that we do: vision, language, movement, walking, awareness, and damage to the brain results in deficits in all these functions.
Right.
Yeah.
Let me ask you something, because I'm curious about this. When you hear somebody has a brain aneurysm or something like that, is that like a mini stroke? Is that something that's leading to a stroke? What is that? And the only reason I ask that is sometimes you hear that and you know, how serious is that? And is it a precursor to something worse?
Great question, yeah. Brain aneurysm is a weak spot on the brain vessel.
Okay.
And the brain aneurysm can lead to rupture. So that weak spot can actually lead to leakage of of blood into the brain, and consequently stroke. So it is pretty serious. When you have a brain aneurysm, it is very important that specialists looked at it, and usually that is an ED specialist like myself who specializes in stroke, or neurosurgeon, and then we we evaluate the aneurysm, and oftentimes, actually usually we can block it. And the blocking aneurysm, usually we do it from the inside the vessel in a minimally invasive way. Sometimes we need to do surgery for it. Either way, we can prevent stroke by removing the aneurysm.
Okay, how do you, and again, how do you know if you're having a brain aneurysm? I mean, a stroke, we'll get to that.
Yes, so ideally you don't want to have the stroke before you find out you have an aneurysm. So aneurysms are usually found incidentally if they don't rupture. So when they rupture, you have a stroke, you have deficit, you have brain bleed. But if they're found incidentally, and they're usually found in setting of something else, let's say you have a headache or other problems, we check brain vessels and we find it. Oftentimes, aneurysms are also associated with family history. So you have a family history of aneurysms, it's good to check for aneurysms. And an aneurysm is something that needs to be checked with a dedicated scan. It's not something that you can detect by clinical examinations unless they rupture. And we don't want it to rupture, so yeah.
All right, now the signs of a stroke. And often, from what I've heard, the person having the stroke may not realize what's going on depending on the severity. Do they even notice themselves what could be going on?
Yeah, good question. Usually patients do experience symptoms. If you have damage to the brain, you will have deficits.
Yeah.
And the most common deficits are loss of ability to move one side of the body, weakness. That could be weakness in the face or weakness in the arm.
Okay.
It could be speech, loss of ability to talk or understand. It could be a loss of ability to walk or gait problems or vision.
Okay.
And this is where we have the acronym FAST.
Yes. Yeah.
So
yeah.
FAST stands for F, stands for face, when your face is drooping, for instance. Or A is arm is weak. S stands for speech, inability to talk or understand. And T is very important, stands for time to call 911.
Yeah.
And there is another additive to that acronym, BFAST. B stands for balance and E stands for eyesight. So if you remember BFAST, meaning balance issues, eyesight, inability to see,
Yeah.
face weakness, arm weakness, speech problem, T, time to call 911. Very important.
Okay, and the reason I ask that
Yeah.
is, there are a lot of folks that live alone. And, if you live with someone else, they may recognize what's going on before you. But that's why I'm wondering if it's happening to you and there's no one around you. I guess it depends how fast it happens, how severity. You may recognize it quick enough to call yourself, call 911 yourself, or is it just so quickly that?
No, it actually can happen. It can happen somewhat gradually. Usually happens very quickly, but a lot of patients are able to notify or call 911. But if they're, let's say, they have inability to talk, or they can lose their important function like speech, in which case they'll rely on their family members or someone who witnessed it.
Yeah.
And if they live alone, this is where we actually recommend having bracelets or other technology to immediately notify the emergency medical system so it can come in and pick them up.
Okay.
Yeah.
Now, let's talk about the receiving center, the stroke receiving center. And how does that operate? And is that dedicated to people coming in just having these symptoms? In other words, you come in, paramedics bring you in, and they recognize the signs. So is there a separate entity over there at Saddleback Medical Center?
Yeah, great question. So brain being the most complex part of our bodies requires complex care. Yeah. So, and stroke is a brain disease, so therefore stroke centers are they're complex centers. They require high level of technology, expertise to treat for these patients. So stroke center is a center that is dedicated to treat stroke patients, and stroke centers have all the necessary equipment, technology, and expertise to treat patients who are likely to have stroke or are having strokes. Okay,
what about some warning signs that people may have pre-stroke? Are there, in other words, a stroke is not happening, but maybe there's something over the coming weeks. Can there any signs that could be given, other than the fact that maybe you have other health risks, but somebody may saying, well, I think I need to go to a doctor because I'm worried that these kind of symptoms may lead to something worse?
Yeah, great question again. So all the symptoms that I mentioned can happen and they can go away. And that happens quite often, actually. About 10 to 15% of the time, symptoms resolve. So loss of ability to see, loss of balance, loss of speech, loss of sensation one side of the body, loss of strength on one side of the body can resolve quickly. And oftentimes patients are reassured, okay, something happened to me, I'm good, and just keep going with my life. No, this is a warning sign that actually that can happen again, and that's what we call TIA. So that should not be ignored, and very important, again, when patients experience signs and symptoms of stroke that I just described, call 911, don't go to your primary care doctor, don't go to a friend, go to this, call 911, because 911 will take you only to a specialized place that can treat stroke. Because stroke can be treated. All these symptoms I described, if they persist, we can reverse them. And we can give medications, or we can perform specialized procedures that can actually unplug the blood vessel, or we can fix the aneurysms if they're ruptured, and all that is offered in Saddleback. That's why we are Stroke Receiving Center.
All right, one more question.
Yes.
We have screenings yearly, every couple years, for breast cancer and colon cancer and things like this. Are there screenings that folks can get about your brain health, about the possibility of a stroke? Is there something, you might be perfectly healthy, but you go in once a year, once every 3 years, depending on your age. They go, okay, we're gonna check for this type of cancer and that type of cancer. Is there something that people can go, can I check how my blood vessels are doing, and something like that?
Yes, great question. So generally, screening for what we call cardiovascular or cerebrovascular disease is a screening for stroke. Okay. So risk factors for stroke are diabetes, high blood pressure, high cholesterol, high smoking, and heart disease also. So if you have any of these factors, then you're at risk for having a stroke. Okay. So check your blood pressure very regularly. Check your cholesterol levels. Check your sugar levels. Don't smoke. And if you have family history of stroke or heart disease, then you're at high risk of having those conditions. So that you have to be even more vigilant about this case, about these risk factors. So. All right. Yeah. Good to see you again. Good to see you too. Thank you for the information, Doctor. Thank you. And I would remind people that you can go online to memorialcare.org/SB and you can get more information there. And the main number is 1-800-MEMORIAL. We'll be right back. Okay, thanks. We'll get you up.